Live from Kaweah Delta, where health is our passion, excellence is our focus, and compassion is our promise, we welcome you to the Central Valley's only 10-minute podcast. We're here to talk more than medicine and empower you with resources and information that will help you live better today and tomorrow. If you have questions for us or want to suggest a future topic for the pod, direct message them to us on our Facebook page or tag us at Kaweah Delta on Twitter. I'm Jennifer Corum, the host of today's podcast. Let's get started with today's topic, the emergency department. I'm here today with Gary Herbst, Chief Executive Officer of Kaweah Delta, and Dr. Kona Seng, Medical Director of our emergency department. Let's talk a little bit about the emergency department, the challenges we face, and the changes we're making to improve for our community.
Great, thank you, Jennifer. You know how much I love to talk about Kaweah Delta and our emergency department, so it's a pleasure being here this morning with Dr. Seng. And a lot of things going on at Kaweah Delta, a lot of activity in the emergency department. As you know, Kaweah Delta is one of the largest hospitals in the San Joaquin Valley. In fact, we have a service area of close to 600,000 people that we take care of. We are a tertiary care hospital, and I think it's a surprise to a lot of people. We actually are the largest district hospital in the state of California. And as a result, we have kind of a unique emergency department, not one that you would find in smaller communities that are, similar in size to Visalia. As a large tertiary care hospital, our emergency department really sees the entire continuum of injuries and illnesses and medical conditions. We take care of patients with simple scrapes and bruises all the way up to heart attacks and major strokes and catastrophic accidents. So it's an incredibly busy emergency department. We are actually a designated trauma center. We're the only trauma center between Fresno and Bakersfield. We are designated as a level 3 trauma center, but just recently we were reaccredited by the American College of Surgeons, and the 2 surgeons that were on staff were just literally blown away. They said, given the volume and the nature of the traumas that you're taking care of, you are every bit a level 2 trauma center. So we actually, right now, just to kind of give you a little overview of the emergency department, up until recently, we had 33 exam rooms in the emergency department, and it had been that size for many, many years. I believe it was first designed to take care of just a little over 70,000 people. But just a few years ago, we were seeing more than 100,000 visits annually in our emergency department, which motivated us to develop several urgent care centers throughout the community. We opened one in Northwest Visalia just a couple years ago, and then over on Ben Maddox, and Quick Care over with Visalia Medical Clinic, which has helped take the pressure off the emergency department, but we're still seeing close to 90,000 visits a year. So right now, it is a 33-bed unit, of which 3 of them are designated trauma bays, right where the ambulance comes in. Most recently, we opened what we call Zone 6, just outside the main emergency department, where we see lower acuity patients, so that added 8 new exam rooms. We're getting very close to finishing what we call Zone 4, which will add 9 additional beds to the emergency department. And the most exciting and final phase of the expansion, what we'll call Zone 5, will actually add 24 additional beds to the emergency department. So when all is said and done, our emergency department will literally be expanding from 33 beds up to 74 beds. And that final expansion we're expecting to be completed in November, December of 2020. So that's kind of an overview of the emergency department, and now I'd love to turn it over to Dr. Seng and have him kind of describe his experience there, and particularly what Zone 6 has meant to him and his crew.
Well, thanks, Mr. Herbst. Thanks, Jennifer. Happy to be here. Thanks for allowing me to share my thoughts. It's been a great project so far in terms of the expansion. I think it holds so much potential for the community. The field of emergency medicine, as Mr. Herbst mentioned, sort of takes care of a wide continuum of patient presentations, everything from low acuity to critical traumas. And that presents a challenge when you are working within a confined number of beds for what really amounts to up to 250 to 300 patients per day. So if you're thinking about 250 to 300 patients per day through 33 beds, you can do the math and see the challenges there. What that does for us operationally is we always try to prioritize our sickest patients first. But because of the confined space, what that means is your lower to medium acuity patients sometimes have to wait. And that is where Zone 6 comes in and where it's extremely valuable. So now that we have this dedicated 8 treatment space unit that is staffed by physicians and physician assistants and nurses, we can get to these patients and they do not have to wait in the waiting room. That's the biggest advantage for Zone 6 thus far. Another space that we've opened is something called Physician at Triage, and this is designed again to ensure that patients are not waiting in the waiting room with critical illnesses that go unrecognized and lead to bad outcomes. So our process there is for patients who arrive as walk-ins to be quickly screened by Kaweah Delta nurses, assigned a triage level, and be seen by a physician within 30 minutes. This process allows us to get things rolling, including lab work, imaging studies, consultations, and start planning for that patient's ED course. That really expedites our treatment and really delivers better quality of care.
So I think Dr. Seng would be the first to tell you that while this expansion is very exciting and critically important for our ability to continue to take care of our community and to create a great environment for our patients, that first and foremost we care about the service we provide to our patients and the experience that they have. And so we're always trying to learn from our community, learn from our patients and families and visitors. I'm very proud of our emergency department. I hear hundreds of stories every year from patients, friends, and families about just phenomenal experiences that they had in the emergency department, literally life-saving care. But we know that we're not always consistent and not always constant, and that there's opportunity for us to continue to improve, and we're very committed to that. Most recently, we formed a new community committee. We call it EDAC, which stands for the Emergency Department Advisory Council. And I'd like to invite Dr. Seng, who participates in those council meetings. I think they've had several since it first started. But what are some of the things that you're hearing? What are some things that you've learned from that advisory council?
Yeah, so that advisory council has been wonderful to be a part of. I think the biggest value for me has been to sit in front of community members and sort of hear the feedback. We're very invested in delivering quality care here at Kaweah. All of our docs are mostly local. They live here. Their kids go to school here. We view our work as taking care of our friends and neighbors. And as such, the feedback that we can get from the community members who talk to their own friends and their own relatives about their experiences as they come to Kaweah is extremely valuable. The things that we've learned from them include processes, communication. It's a two-way sort of thing where I get to learn from them and they also get insight into our operations and our challenges. We involve them in certain projects and decision-making so that they can help guide what we are trying to do and make sure that we're on track. So far it's been a great success. One of the main successes for EDACs, I think, was the invitation for several of those members to come plan our mock runs for our Zone 6. So before we even opened up that new space, we had our EDAC members serve as pretend patients, and we monitored everything from the timing to the communication to the way we delivered medications with the help of Dr. Kimberly Sokol, who is our ultrasound simulation director here at Kaweah Delta.
Great, thank you, Dr. Seng. The last Seng, so yesterday was October 1st, and for those of us in healthcare, that kind of officially kicks off the start of the annual flu season. I got my flu shot yesterday, and I just want to let everybody know that I feel just great today. Contrary to some of those urban legends that you hear, you do not get sick from getting a flu shot, and I'm just here to tell you that I feel great today. So, Dr. Seng, the flu
Yes.
is likely to arrive here shortly. One of the things that we do just to kind of gauge how severe or mild it might be, the flu generally starts down in the southern hemisphere of the world, and so we pay attention to Australia and New Zealand, and we've been hearing that they had kind of a moderate to severe flu season this year. So what words do you have to our community, emergency department, urgent care center, their offices? What would you like to share with them?
Well, first off, you're absolutely right. We've been monitoring the Australian flu season to kind of help predict what we'll experience here in the United States and California. I thank you for being proactive and a servant leader and getting your flu shot. That's outstanding. That would be my first point, is that it's very important to get our community out there and get vaccinated. It protects us in many ways, and as you said, it's probably best practice and would definitely help throughout the flu season. Secondly, there are certainly populations within our community that influenza is a serious thing for, and that would be patients who may have cancer and are undergoing chemotherapy and their immune systems are not on par. The elderly, the very young, those are patient populations that flu affects quite drastically. That being said, there's a fair number of patients as well who may have flu-like symptoms and don't necessarily require the services of the emergency department. And as you said, we've worked extremely hard to get multiple urgent cares up and running in town, and those are perfect places to be evaluated, as well as your primary care office.
Very good. All right, thank you, Dr. Seng, and again, Jennifer, thank you for giving us the opportunity to talk about our wonderful emergency department, all the great things that are going on, and what this community can expect in the coming month and coming year.
Thank you so much. Thank you for joining us and learning how we're improving our emergency department for you.